iPhone. Hello, good evening, everyone. Are you hearing me?
I hear you.
I hear
Okay.
you.
Good
Hello.
evening, good evening, everyone, and welcome to all tonight for the February 2022 Health Hospitals and Social Services Committee. I do want to welcome all of our guests and especially to our committee members. Tonight, we will be speaking about COVID-19 and the effects on the youth. Tonight, we have Mr. Julio Batista, who is the Community Affairs Liaison at New York Presbyterian Hospital. And we also have Dr. Myra Meningas. Did I pronounce your name good, Doctor? Yes? You're muted.
Mara Mingus.
Myra Mingus. Dr. Mingus is the Assistant Chief Medical Officer for Community Affairs at the New York Presbyterian, and she's also the Medical Director for the Long Youth Medical Program. Let me let you speak a little bit about the Long Youth Medical Program. So thank you again for being here, and the floor is now yours.
Thank you. Thank you very much. I'm going to share here my screen. Perfect. Okay, so let's start here. Okay. Perfect. And thank you for that. Yes, and thank you, Julio, for the invitation. Thank you to all of you for inviting me to come over and have a chat. I know that you're all oversaturated with a lot of different talks and presentations about COVID. And even that way, we still have updates every single day, including today, a very, very big update. So this is going to continue. We still have some conversations to have. And I'm glad to be here because you are all incredible conduits to really just continue to talk and educate others in the community. We're almost there, but we're definitely not completely there. So that's important to know. So one of the things I want to do is just focus and mention to you, I know that we have spoken quite a bit and you may have heard quite a bit about everything that's happening and we're going in a good trend. So this is a positive conversation, right? We've had many different conversations that were not as positive. This one is positive. We are going in a good, actually, trend. It's a very, we can see the light at the end of the tunnel, but there's still some gaps. And one of those gaps I want to talk about today, and that is the vaccination rate in the youth. So I want to talk a little bit. That's actually the newest population that we were eligible, that are now eligible to be vaccinated and even now boosted, right, above 12. So I want to talk about them because we really want to protect them before the mask mandates even expand beyond what they're going to expand as of today or tomorrow into the schools. So we want to make sure that our kids are protected so that we don't go back to places where we've been before, right? So before we do that, we can't move forward without really just understanding the magnitude of what's transpired in the last couple of years. And also it reminds me of, we've all been impacted, all of us. It doesn't matter what level, every single one of us has been impacted by the pandemic, right? We have here just globally. I mean, not long ago, I keep changing these numbers and they increased dramatically, 500 million confirmed cases globally and nearly 6 million deaths. This is pretty incredible, and pretty much every country has been impacted, right? And in the United States, look at this. I just changed these numbers for about 2 months ago, and it was a substantial increase, 77 million cases confirmed. And we are just reaching that big number here, over 900,000 reported deaths. And here, if we just condense over to us, how does it impact us? You know, we started here in the United States, this whole trend We are over 4 million cases and now over 65,000 reported deaths. So someone here has been impacted in a more magnitude of a death or some sort of reason that they've experienced because it's been quite dramatic. And another thing that's really just kind of honing into, let's just talk now about kids, because everyone's really in a positive light, but I do want to make a case to all of you to really continue to promote vaccination, because we still have a gap and everyone's really excited about positive moves, but we still have to understand the data and the numbers so that we could stay in a good place, right? So over 12 million kids have been reported since the beginning of the pandemic, right? And yes, they do fare much better than adults, and that has been an incredible blessing for all of us, right? And hospitalizations, it really has not been much, as you can see here, 1.6 to 4.7%. And I must say, this is by the American Academy of Pediatrics data, and not every single state reports. So unfortunately, we try our best to get all the data, but not everyone puts all the information. And as you can see here, deaths, look at this, 0.00 to 0.24, which is actually really a good number. But again, when I do these talks, I have to say, even one is too many, right? Because who's going to tell that person, that the parent who has to experience this, it's really 0.24 when their kid may be in that space, right? So a couple of other things and just generalities for all of you. And again, I'm making a case that there's a gap and I need you. So children's here, look at this as of February 2nd, right? This is the information. We have approximately 30% of the kids that are from 5 to 11 who have been, who've had at least one of dose of the vaccine. And look at this, 22% fully vaccinated. So not a horrible space, but 22%, we have a lot of room to grow and actually stay at a good space, right? Then let me just show you a little bit of the older population, 12 to 17. As you can see, 65% had at least one dose. So they've been eligible for quite longer period of time than the little ones. So that's also a factor of the timing. And also, as you can see here, 55% fully vaccinated. And overall, by the way, just including adults, we're at 80.5 per the CDC. I just checked the numbers today of at least having one dose, which is actually pretty phenomenal in the entire country. So a couple of other things I always mention, I'm sorry, this one, it's not gonna move forward. All right, again, just really comparing the death rates, they're less than 0.5%, okay? Which is not many, but look at comparison, very comparable to flu as well. And we just have to keep, again, in mind, and I've done this presentation also for many parents. So we just have to, it's just a context. It's a lot of numbers, but it's just context. And one of the things that I really like to talk about, and I promise we'll have plenty of time for discussion, because I always learn from you as well, is looking at how it's been impacted. So we had lots of numbers that I showed you. I show you deaths, hospitalizations, but look at this, right? We have a great portion of the kids we had over 120,000 kids. They actually had someone who died, whether it was a parent or a parent or a very close caregiver. And that's why it led to our Surgeon General talking about and making it an emergent statement that mental health in the youth is a huge public health concern. And we're looking into the ramifications of this pandemic. And I could talk quite extensively regarding that perspective. I am a medical provider, a pediatrician, adolescent medicine trained. And for the last 20 years, I have been here at New York Presbyterian in Columbia. I serve in a school clinic. So I see Mondays and Thursdays, I'm there, I'm still seeing patients. So I could talk extensively about the impact that it's had on the kids, absolutely. And education, we're still yet to see what's gonna happen. But as we can see here, the number one, worsening of mental health and emotional health, a lot of depression. More than that, I've seen quite a bit of anxiety, a lot of anxiety, the uncertainty of the next what's going to happen next has caused anxiety in the kids. Okay. Educational gaps, we're still yet to see what's going to happen in terms of widening of the educational gaps. And I have seen it firsthand, right? Some kids that actually didn't have the resources to really move forward, or even just months ago, we had teachers that were not able to move forward in their teaching because there were such a large of kids that they were out. So that's really important. That impacts everyone. Decreased physical activity when they were actually at home, and that's important. And also not going to different spaces that are public because of the concern of getting infected. And healthcare utilization, there's really good data that had dramatically decreased. We're getting back on track, but it did. And kids were not coming to get the regular vaccines because they didn't want to be in spaces. They had there was a phobia of being in medical spaces for many reasons, right? Of course, that are completely valid. But we had a decline in healthcare utilization for specifically preventive health, okay? And I mentioned decreasing immunizations as well. And, we talked about the loss of caregivers and adverse childhood experiences we can talk about. These are the experiences that happen in their life, such as losing someone, such as actually, abuse or of some sort that we've also experienced with some of the kids that had to stay home during this pandemic for long periods of time, because school is always, they're out, right? They can spend hours somewhere else, and now they were kind of spending a long period of time at home. So this is really key. And we have here getting vaccinated. Of course, it's really, it has gotten us where we are, right? And talking about really not using the masks, right, indoors. Being vaccinated has gotten it here. Reaching 80% of the entire US population has gotten us here. And that's really key. And I know that a lot of people say, but I've already got COVID. I already have natural immunity. Why do I have to get vaccinated? Well, it is absolutely recommended because we don't know how long that natural immunity is going to last. We really don't. And I always mention one of my friends, colleagues, who tested, the antibodies, and then this is before the vaccine, and she only had antibodies for about 4 to 5 weeks. It was reaching that 5th week. Some people get antibodies for 3-6 months, but we don't know. What we know is the antibody responds when you're vaccinated, because there are actual studies, right, with a lot of people that are able to, that we have better data. That's all. It's just having better data. And I know some people feel like, oh, but I'm so confused because the data changes, and I get it. I do have to say that we are living a phenomenal time when it comes to scientific approaches, because things have really expedited the amount of scientific learning that we've gone through in the last 2 years. And not learning, expansion as well, because a lot of this was already there. By the way, the vaccine, and I'm happy to talk about it, not a new concept, messenger RNA, decades. That has been on the table for a long time. It's not brand new. It's just that we were able to implement it and produce it. Let's see what else. And I'm happy to go back. This is just to show you, because I know that a lot of people say, but, vaccine in the kids, this is what's happening. Well, the vaccine in the kids, this is actually just to show you. It was a very good study. This is here how many kids received the vaccine, and they did even better. Their efficacy was even better than actually what was found in adults. And everyone's concerned about the side effects. I have to deal with this every time I'm in clinic. I vaccinated quite a bit of people, and I still do. So one of the things, just to let you know, they actually do better, and I've seen it in my clinic, than adults, but they still can get the same symptoms that those that are above 12, such as fever, fatigue, headaches, and chills. I've seen more of the headaches and just feeling tired. But I do have to say, kids do so much better than adults in terms of not having to miss, the next day of work. We get adults, I've got chills. So a lot of people get chills on the next day or some sort of low-grade fever, and kids are doing much better. And I've seen a lot of them. Very few of the kids that I've vaccinated miss school the next day. And this is just quickly. They did not find in the studies any anaphylaxis, myocarditis, all these concepts or illnesses that we've heard in the past. And I mentioned no appendicitis, which I guess they mentioned it because it was seen, I guess, in the adult population. A couple of other things just to mention, all right? Couple of things that have changed dramatically, and we'll do the next mask later, but the boosters now, everyone, okay? If you've completed your series, your first and second dose of Pfizer or Moderna, or your Johnson & Johnson over 5 months ago, and you're over 12, you are eligible for a booster, recommended. So they did actually, they already knew this data a couple months ago, but it came out not long ago in print, which was a data from South Africa, where they noticed that in this time frame, specifically to Omicron, right, efficacy, it just went down to 30s and 40s, and then if you got the booster, it went back up above 80. So it's really important, or around 80. So it's really important to be boosted, and because of Omicron, which is now the 99% of our infections are due to Omicron, it is definitely recommended. Another thing I want to mention is the positive, all these different changes and recommendations. What do we do with, isolation versus quarantine? And it's important to know the difference. An isolation means is a person who had a confirmed positive test. Quarantine is that time frame where you are going to be away from people because you were exposed. Okay, so that's the difference. Isolation, positive test. Quarantine is just exposure. So if you have a positive test, this is the new recommendations, and I know you may know that it wasn't as of long ago. So 5 days of isolation plus wearing a mask for 5 days. That's across the board, vaccinated or unvaccinated. This is what it's recommended if you're positive, right? It also depends on symptoms. So that's a little bit of a different caveat, is if you're still symptomatic at this time, you're going to really just wait until you're symptom-free as well. Then exposure and quarantine, it's divided into 2 different tiers. Is vaccinated or booster, then you wear a mask for 10 days, which we're all kind of wearing in many different settings. I know things are going to change in the next 24 hours, and test on day 5. That's their recommendation. If you're unvaccinated or have an incomplete series, you only got the first one of Moderna or Pfizer, then you stay home for 5 days and then mask the next 5 days, and suggested to test on day 5. Okay. And I'm happy to answer any questions around that. Then today, yes, it's a big deal. And I know that most of you was looking in the news, and I know I saw different things, right? I saw the CDC leadership saying, hey, I'm not sure if we're ready, but New York State, we have our governor who has said this is what we're going to do. Okay, so we're going to uplift the mandate for indoor businesses as of February 9th, 2022. And that's actually, some say 9th, tomorrow. She just mentioned it today. And this is really key. The mandate will continue for schools, men's transit, and hospitals. Okay, so we cannot toss away our masks. We still have to maintain them to make sure. But what she's meaning is, since we all in New York have gone through this whole asking for vaccine cards, now that's going to be lifted. And even that, it's a good day to talk about this and the gap in vaccines for the younger populations, since today we're actually releasing just kind of cutting back on the mask mandate, because we do want to make sure they are protected and that we don't go back to a space where we have to just be restricted again. And we've already again been there, right? And as this virus continues to propagate, we definitely will see, and it is expected, right, when there still continues to just replicate, to see some variants. And what we want is just to make sure that we can halt that process of production of variants. That's going to be really, really key. But what I'm going to do now is actually stop sharing so we can have a conversation, since it's a nice intimate group.
Yeah. Thank you so much for that presentation. Very informative. We never really went in depth about the effects on the youth. So I want to thank you so much. So are there any questions for Dr. Meningas? No, I'm sorry. Before we went on the question, I was sorry. What could you explain to me the long youth program a little bit?
The Lang Youth Program?
Yes.
Sure. No, absolutely. So on one of my other hats, it's the Lang Youth Program Medical Director. The Lang Youth Program is a 6-year medical pipeline program for kids. It is specific at this time for District 6 kids. It's been around for quite some time, and it's 6 years. So the kids actually come every Saturday during academic year for 6 years and the summers. And basically what we're trying to do is increase representation of the underrepresented minority in medicine, which is Black and Latinx. And that's the goal, is just to continue the philanthropist who started the program thought, how do we bring these kids how do we have medical providers inside this hospital that also look like the community? And that's when it started.
Is that Eugene Lang?
Yes, it is Eugene Lang. Absolutely.
Wow.
Yes. And we started, yes, Eugene Lang. Amazing work he has. He was incredibly supportive. Started it in 2003 in collaboration with our president at that time.
If I may, he's the fellow who sort of on a whim told a class of sixth graders, I think it was, that when they graduate, if they go to college, he would pay for all of their tuitions, which he was the first person to ever do it. And many people followed him later on, but that's the same guy. Amazing guy.
It is amazing. And can I tell you, I was fortunate enough to be present in his funeral service, and several of that class spoke, and that was definitely caused chills. How amazing, right? And the whole concept actually for him is longevity. You can't just help kids like one summer, 1 year. How do we do it so that we continue to a continuum of time frame? We also have an alumni group, and from the alumni, we have now 6 full-time nurses and administrators at Columbia and NYP. So it is just, what do we do? What do we do to support them? Because it's really key.
And what he did was he took this East Harlem school, and you're right, he did not just pay for tuition. He set up training, tutoring programs and mentoring programs to follow them along. His history is amazing. So thank you.
No, and thank you for really bringing his work to light, because it's definitely this is just one piece. The Lang Youth Program at New York Presbyterian is one piece of all his amazing work. So thank you for asking.
Okay, are there any questions for Dr. Meningas?
Yes, anything at all. And I know I'm here for whether it's youth related, any question that you may have. You still continue to be the conduit, like I mentioned, of information, and we continue. I still have a lot of kids at the schools that are not vaccinated, and I'm still talking to parents, please. And their thought behind it is, well, it's getting better. It's getting better, so why do it?
Yes.
Can you hear me?
Yes, I hear you.
Yes.
Yes.
Okay. Yes. My brother is here from Florida. He has had only 1 shot, no documentation. Can I just take him into a local site and get the second shot?
Absolutely. Now, when you say no documentation, they may be able to find, because I have been able to find some for other people in other states. So definitely he should go. And the reality is that if he gets, let's say he gets 1 and 2, so it depends on the time frame, but he can definitely go and get another one. He should go get another one.
Oh, definitely. I just wanted to know if he would be eligible.
Absolutely.
Oh,
absolutely. Since he hasn't had the second one. So it doesn't matter when.
No.
We want his antibodies to come back up and for him to be protected. And those are the, we want to protect everyone who may be or not vulnerable. And this is why we need the kids to be protected. Because they're kind of these beautiful bundles of joy and bundles of germs that we love to kiss and hug, and we need them to be protected. So it's really important to make sure.
Right.
Of course. And good luck to him. I hope he has a good time here in New York.
Dee Burke, I see your hand is up.
Yes, I have a question. You spoke very eloquently about the deficits that the children are experiencing. From the medical side, from the real research side, will anybody be looking at the academic deficits and the long and short-term effects from a real scientific perspective?
Oh my gosh, that is such a great question. And I really hope so. And I think it's going to happen. I've actually had some conversations about that with our district, and I really hope it happens. So one of the measures we're going to see, okay, so immediate, what we're going to see, let's look at the metrics that we already gather, the data that we already gather yearly, which is in New York ELA, as well as high school graduation rates. So let's see what this is what the metrics, let's go back to the fundamental metrics that we already always use for basis of comparison, which is ELA grades. And we'll see SAT scores, you see the different geographic populations and also ethnic backgrounds, and see how does that fare from 3 years ago. So we at least will have that, but I agree with you 100%. And there is already underway quite a big amount of work in terms of mental health. There's a lot of work on that, the anxiety, which could impact the learning too, right? So it's not just the pausing learning and learning virtually, which is such a different concept, but it's also how our mind and its kids, I love them so much, especially adolescents, their minds are wired and anxious, and it's such a hard thing to learn. Picture learning while you're running, right? Like it's difficult when your mind is just really stressed. So we're going to have to deal with that as well.
I was hoping there would be a really close look at the early childhood first graders, the beginning reading, and what happens in pre-K to make it more experiential and not academic, and to measure those things quickly, because
I love that.
we're losing them.
What a great concept. I really, really hope they do, especially because you're hitting on something that you may be, or I'm thinking you are, is the socialization, right? A lot of them lost, right? There's some toddlers that didn't have the same socialization with the play dates that for several years. So I wonder that early childhood component of how socialization, the lack thereof, is going to impact our learning as well.
They have
Very
to
good
muck
question.
around and get dirty and do all those small and large muscle things that mitigate the success later on. But anyway, thank you very much for your work and
Thank
your
you.
time. And District 6, say hi to Manny.
Oh, I will. I will. Thanks.
Thank you so much. Are there any more questions for Dr. Meningas? Questions?
And if anything comes up, Omar, please feel free to email us. I do have, by the way, next week, February 16th, and we can send you, if you know of any pediatricians or medical providers in the area, we're going to have a presentation by the chief, Dr. Melissa Stockwell, chief of our division of child and adolescent health, to talk about COVID, because we still have some community doctors who may or may not inform their patients
Right.
accurately in some ways. So we definitely want to be in the same page. So we are all as best as we can. So if you know of any pediatricians, we'll send you the information, because that will be key to have this,
Right.
be consistent with the information.
Right. I'll email you and Julio, and I will fast forward you the board email address so you could send it over.
Great.
Thank
Okay.
you so much. Thank you, Julio. And please contact
Thank
us for any other medical topics.
Right.
That's what we're here for.
Thank you so much. I appreciate you coming tonight. Julio,
Thank
Yes,
you.
hi,
are
Omar.
you there?
Yes.
Julio is the community affairs liaison. Julio, you were saying something about mass giveaway or something? Were you saying?
Sure. So thank you, Omar, and thank you, Mara. As Dr. Meningas said, the governor has lifted the emergency mandate. However, that does not mean that we will not, need to trash our masks. We will still require those masks on the subways, public transportation, airport, hospitals. So, and of course, local jurisdictions will also have their own rules. So we're not ditching the masks. So we want to be able to be supportive of our community, and we've supported and worked with KRVC, which is, I'm not sure the Kingsbridge Riverdale Community Service Development Corp, and also with the Marble Hill Houses, providing them some masks and support them with PPE. And of course, this is something that we want to continue to do. So I just want to give the word out to the board and to the New York committee that if you know of any groups that will be interested, by all means, Omar, let me know, and we'll get them some batch of those so they could use. And of course, we also have hand sanitizers that we can also provide. Especially as groups start doing things more outdoors, it's better to be safe than sorry. And so we do have some of these supplies that we can offer to folks in our community as they have these now in-person events. The other thing I just want to also add is that, these are also times where a lot of seniors are still bundled up in their apartments, trying to find activities that they can participate in. And we do have a program with Health Outreach, which is run out of the Allen Hospital, which borders Community Board 8. And we'll be more than happy, again, to share that information with the committee and with you, Omar, so that if we know of any seniors that would like to participate in some of these virtual, activities or presentations, they can do so as well. This is a resource that we have available and want to continue to expand as we move forward. So again, thank you, Omar, for having us, and here to support any way we can for your committee and of course this community board.
And thank you so much for coming. I really appreciate this job that you're doing. Okay, much appreciated. Thank you so much.
Is there a direct email address for Julio or for the doctor?
Sure, I could give you my email is jab9029@nyp.org. So again, it's jab9029@nyp.org. And if you want to, you can email me, and I'm sure that whatever questions or concerns, if you have questions for Mara, I'll make sure that she gets that as well. So by all means, feel free to email me.
Thank you very much.
David, your hand is up or something?
Yes, thank you, Omar. Julio, if you don't mind, our community board office has been sort of a resource for distributing those things. If you wouldn't mind calling our office just to check and see if they do need masks or sanitizers or whatever. I don't think so, but I think that would be one of your best ways to get things distributed within our community. Because I know our committees refer people to the office.
Okay, sounds like a good plan.
Do you have the phone number there?
Yeah, I have the phone number, and I believe I have an email as well.
Okay, great. Thank you.
Sure. Thank you for the suggestion.
Thanks for the offer.
A pleasure.
Bye.
Okay, everyone. So we have a little house cleaning to do. 3 sets of minutes went out. One for January, October, and I think November. I see Bob, I see you there. I see Kimberly, I see Sebastian, and I see Karen. Do I have, is there any questions on it? Do I have a motion to approve?
I'll put a motion to approve.
Motion approved.
Okay, motion to approve. All those in favor, all those that are against, raise your hand. Abstentions? Okay, those 3 minutes have been approved. So next up, David, I see you on the call tonight. I want to talk a little bit about budget. Let me see if I can hear my screen. Are you seeing my screen?
Yes. On its way. There you go.
There you go. Okay. All right. So let's take a brief look at the budget that we did last year. So for number one, funding for counseling services. And then number two was an expense for PPE medical supplies. And then number three, a citywide for a committee to allow for residents to voice their concerns about COVID-19.
Oh my God.
And then the other one is for funding for domestic violence, for the domestic violence of the 50th precinct. Some of these was, correct me if I'm wrong, David, but some of these were merged with other committees, right? Yes, remember?
Yeah, I don't think that this is how it finally came through. If I remember correctly, Kira had suggested that you not address the PPE because she had those resources like I was referring to a few minutes ago.
Right.
So I don't think that even showed up, but I honestly, I don't recall what your requests were last year. But as I've suggested in the past, I encourage your committee members, and again, this is up to you folks, but I encourage you folks to be creative. What do you think is important for the community? And
Right.
keep in mind things you've asked for in the past and whether you want to underscore them. But, you know, it's a new year. And we're really talking about a year and a half from now, that budget. So I'd encourage you to be creative about things that you think are important for health, hospitals, and social services within our community.
Right. Thank you. Committee, what do you think? Bob, Kimberly, Sebastian.
Right.
Bob, I see your hand is up.
Yeah, one of the issues that I really feel that we need to double down on, the fact that the Bronx has the worst healthcare statistics of any county in the borough, in the state, is the issue of healthcare disparities. And I really feel that if we could, to follow the admonition to be creative,
No,
I think we have to creatively approach this issue of
no,
healthcare disparities and
no.
understand what this really means for those living in our community board and how it affects them far beyond, and it obviously affected folks in healthcare disparities very dramatically and deadly under COVID, but how does it affect people endemically? What is the role that healthcare disparities plays in these statistics in the context of community board aid? Perhaps a study needs to be done and recommendations need to be given on how to fully address or more fully address the issue of healthcare disparities in our district.
So let me get what you're saying. Are you saying to create an expense line to provide funding for a study? That's what you're saying?
A study, yes, a study. A real demographic study of the impact of healthcare disparities within certain confines, within certain areas, to take a look at the endemic impact of healthcare disparities upon the population in our community board that would also have recommendations. And perhaps along with that, a forum that could be run in the community to really let our elected officials and community leaders understand the depth of the impact of healthcare disparities.
Good. Very good idea. Ms. Burke, is your hand still up, or is it from before?
No, I'm sorry.
Okay.
By the way, just a quick editorial. A very good idea that I think you folks should consider. Do try to keep in mind, you should have a target, like in what you're describing, Bob, for DOH, MH, or Health and Hospitals Corporation or some agency to find a budget area for this.
All
So
right.
I know that there is a task force, and obviously we've heard from them before, faith-based task force and other task forces from DOHMH. And I think that they would probably be statistically and from a study point of view, that they would be best placed to be able to do this. So perhaps if this idea is something that we want to follow up, we can talk additionally or offline to figure out what the exactitudes and what a cost might be.
Good, good, good. Any more comments? So here's what I'm gonna do. From the budget from last year, I'm gonna send it over to the committee members, and I want you to take a look at it and brainstorm and see what we could come up with. And of course, David, I'll be contacting you for whatever help that I can get from you. All right?
That's fine. Just keep in mind that your ideas should be coming out this month so that next month you can prioritize the two separate lists of capital priorities and expense priorities, and then finalize both of those lists in April, by
Right,
April 20th.
right.
So-
All right, so I'm gonna send it out this week and everyone can take a
Okay.
look and see.
Whatever works for you and your committee members.
All right, thank you. Any more comments? Any topics for discussion? All right, ladies and gentlemen, thank you so much, and it's a pleasure seeing you tonight, and to all our guests. Camilla, good to see you tonight. Madam Chair Spalter, good to see you tonight. Saharbi, and I don't,
Always great to be here.
yes, thank you
Very,
so
very,
much.
very instructive. Love, wonderful guests.
Thank you. So thank you guys so much for coming out tonight. I really appreciate seeing all of you, and I want you to stay safe until next month. And we will be discussing more on the budget. All right. So thank you so much, and good night.
Good night.
Thank you, Omar. Good night.
Good night,
Thank you.
everyone.
Good night. Thank you.